My name is Elinor Larney. I'm the Registrar of the College of Occupational Therapists. On the line is Jane Cox, who is our current president of the college. And beside me here in the room is Shannon Gouchie, and I'll just let her scooch over and say hello to you all.
Hi, I'm Shannon Gouchie, and I'm the Vice President, and I'm the outgoing member in District 5, which is our Sudbury or our North Ontario district.
Do you want to say a little bit about yourself?
Hi, my name is Jane Cox, and I'm currently the president of the College of Occupational Therapists of Ontario. I am on council as from the Southwest District. I think that is District 1. So my area is up for re-election, so happy to answer any questions of people who may be interested in running for council.
All right, so today what we're going to do is, if you're going to think about running for council, you need to understand a little bit about regulation. What is the role of the college? What your role would be as a council member if you were elected? What some of the things are that we're doing here at the college, and some of the logistics. So how much time does this take? What does it mean in terms of your job and all that sort of thing? And we'll have some time to answer questions. So we have a polling thing there where you can ask a question, and we will take your questions at the end. We'll just move along. So regulation of health professionals matters a lot. The government has invested a lot of money in terms of setting up the whole Regulated Health Professions Act. The college is here to ensure that the public is protected and that occupational therapists who provide service are qualified and they provide quality health services. So there's a lot of things we do in terms of setting and enforcing standards and guidelines for occupational therapists. As any of you have gone onto our website or pulled out your old binders, you'll see that all those things come from the college. If there's concern about the care that an occupational therapist has delivered and the public has made that known to us, we certainly investigate that, and that's part of our role. In terms of occupational therapist role in self-regulation, everybody has to take a role in doing this, and even if it's just by participating in the election by casting a vote, and hopefully you are on the call because you're thinking about standing for a council position or nominating somebody, and so all those things are super important. And I'm going to turn it over to Shannon, who will give you some comments from her perspective, being a member of college for 9 years.
Just in terms of my background, I'll admit, and I didn't know a lot about the college. I mean, obviously we would get the standards from the college, we would get notices of elections, but I was interested to participate, to learn more about it, and certainly after having those 9 years on council, I very much appreciate it and feel that I have a better understanding. I don't know that everybody from the outset realizes that it is really about public protection. It's certainly not a role of advocacy. That's what our association is for. So I've really learned to appreciate and understand our role in protecting the public. And as well, I think just to be on the forefront of the development of standards, the fact that transparency is a huge kind of issue right now, and to be able to be on the forefront of development of that from our college perspective. And really, of the 9 years, there's been different kind of trends. Right now, it's transparency. In the past, there might have been a bigger focus on, developing our standards because we've come a long way in the last 9 years. I don't know if Jane might have more to add.
Yes, I think certainly Shannon and I came onto council the same time 9 years ago, and 9 years has certainly flown by. My background prior to coming onto the Coteau Council, I did serve on both the board of OSOT and CAOT in the past, and I certainly was looking for an opportunity to become involved in setting the standards for our profession within the province, and certainly public protection is at the forefront, as Shannon has mentioned. I think one of the exciting pieces that's coming up now is the work that Elinor is involved in, particularly around establishing competencies that will go across the country. And I think this is exciting work for our profession, But I think as well, it's most important for the public protection, recognizing that there are specific competencies that an occupational therapist must have in order to practice safely. Shannon did mention about the changes that have occurred in her 9 years on council in relation to the standards, and I would describe it as a maturing of the work that's done at the college on the standards that we all abide by.
Okay, thanks, guys. That was really good. So in terms of the role of a council member, you've heard from both Shannon and Jane. Making decisions in the public interest is a very important part of the role, the work that we do here at the college. One of the other things that happens is statutory committees. So the council does meet as a whole to make decisions, but also there's committees that meet and do more specific work related to who gets to be registered here, what happens if there's a complaint, how do we evaluate and take our standards to the next level. So there's committees that do all that kind of work, and all the council members participate on some of those committees. There's also policies and regulations and bylaws that the college makes, and we respond to laws and legislation that happen through the government, and then we must respond, and council has to make decisions about how we're going to respond. Jane, do you have anything you want to add about that?
I think one of the interesting things being on council is that greater understanding and appreciation for the development of regulation standards and involvement with the government. I think the other piece for me as a council member, what has been interesting is to see what the public members bring to our council in terms of their experience and their understanding. And I've always found it interesting to watch the education of the public members and understanding what it is that an occupational therapist brings to patient care and protecting that patient interest in our work. So
that's great. Shannon?
Again, when I came onto council, I didn't have a lot of experience when it came to being on a board, and I would say that that's been an excellent experience. I mean, whether you have board experience or not, you certainly learn from this in terms of learning kind of what governance processes are and procedural processes. I concur with Jane, definitely seeing the knowledge and the perspectives that the public members bring has been very enlightening. Training has also been very, very helpful. So our public members have the opportunity to shadow an occupational therapist, so they do have a better understanding of what occupational therapy is. And I think that we learn a lot from the public members in terms of their professional experiences, their board experiences, and then overall, again, our linkage to regulation, bylaws. I think that I always did have a little bit of a nerdy interest in regulation and policy, and this really has enabled me to understand that a little bit better.
I think maybe I'll just add a little bit further in terms of the work that's done outside of the council meetings of all the council members on the statutory committees, and that really is where you're getting involved in the work of the college and producing the documents. And that in itself is an education, being involved in that aspect of things. And as Shannon has already mentioned, learning how to make decisions as a group and managing as a board has also been a great opportunity of growth for myself.
Great. So what I wanted to let you know a little bit about some of the things we've been working on, and very interesting work. Transparency, Shannon mentioned that. Some of you who've been paying attention to our bylaw consultations that have been out over the last little while, the government is expecting us to be transparent and more transparent about the work that we do here at the college. So the decisions that we make, whether they're policy decisions or whether the decisions about specific occupational therapists, many of those decisions are now meant to be public and can be found on our public register. the government is also working on their modernization agenda. So the RHPA, the way we know it today, may not be that way for another 20 years like this one has been. And so, we're working with the government to see how we can assist them with making the laws about regulation of professionals work for our province. The government is also expecting that we are engaging our patients more and more. So while we do have public members on our council, and in all our statutory committees, they want us to be a bit more broad about engaging patients. And those of you who work in the hospital system probably have already experienced that, having patient councils and that sort of thing. We are starting to do that kind of stuff as well. We've been working for the past 10 years on the Psychotherapy Controlled Act. That deadline is looming now, and if they do pass that by the end of this month, then there will be some implementation that we have to roll out for that. Jane already alluded to the One Set of Competencies project, so that's a Canada-wide initiative. It's a huge project for us. It will involve the entire country. It's very, very exciting. And also, we're right in the midst of reviewing and revising our quality assurance program. So lots of decisions being made, lots of work being done, and that's just a small sampling of some of the things that are going on here. So what does this mean in terms of commitment? So I know that both Jane and Shannon have told you they've been on council for 9 years. This is not a 9-year commitment. It is a 3-year term. And if you are elected 3 times, then it adds up to 9 years. So both of them have been elected 3 times. But for the first go round, it would be a one time of 3 years. And so the term starts April 1st. And if you are elected, then you would participate at our last meeting in March and be an observer, and then participate in the election for the president and the vice president on that meeting. There are 4 full-day council meetings per year, as well as we usually have 1 education day. And each council member sits on at least 1 statutory committee, and sometimes more than that. There may be subcommittees or working groups, and some of them, depending on how busy they are, they could meet once a month, once every 2 months. We meet during the day. We do pay for travel, and there is a small stipend that we also give our people who are elected to help compensate them for the time they spend. And most meetings require some preparation time. So if you're reviewing cases, then you would be required to read them and come prepared to discuss them. Anything you guys want to talk about related to participation on?
I can just say that I reiterate what Elinor had said in terms of the amount of commitment really depends on the committees that you are assigned to or that you have expressed an interest in, because some of them may only meet once or twice a year. Your commitment may only be, the 5 times for council education and then those 2 additional meetings. Otherwise, you could have a greater commitment if you are interested in committees that may meet, every maybe once a month. And typically, committees probably don't meet every month, but at least every 2nd month. So there could be a greater commitment there, but certainly that's taken into consideration at that very first meeting that you're an observer at, when you are asked to specify what committee might interest you, and Elinor will go into those details shortly.
One of the things to think about is if you are interested in a council position, it is a very exciting role to play. However, you do have to be prepared for the time commitment and make sure that you speak with your employer ahead of time and say, I'm going to need some time. How is this going to work? All that sort of stuff.
I'll just add something there, Elinor. I think certainly employers, at least my employer, I will speak for, has been very supportive of being involved in college activities. I think, again, from an employer's point of view, again, depending on your position, but certainly it's seen as a feather in the cap, I guess, of the organization to have somebody serving on a regulatory body. So, as I say, they have been very supportive of my involvement over the time that I have been involved. So, appreciated for sure.
And I think that is true for most of the council members that participate on council. is their employers are very supportive and they really feel that they bring back as much as the employer might lose in terms of the time that they spend here. So in terms of council meetings, this is just the months that things happen, and as I say, they're full-day meetings. October, we try to do 2 days in a row just to provide some education, and we try to have education at every council meeting as much as we can, depending on our business. That's just the schedule of events. Here's a list of the statutory committees. So executive committee has some oversight in terms of how the council meetings run. They prepare a lot of things like the bylaws before it gets to council. So once it gets to council, it can be a smooth discussion. Registration, basically their job is to, deliberate on any registration, application for registration that doesn't meet our requirements, or there's a concern that they might not meet our requirements, and they make the policies for who gets to be an occupational therapist in Ontario. The Inquiries, Complaints and Reports Committee, or ICRC, they are a screening committee that looks after any complaint to the college or a mandatory report, and reports come to us if somebody has been terminated from a position because of concerns related to their conduct or their competence. We do have discipline hearings at the college, and people might participate in a discipline hearing. So once the screening committee has reviewed the complaint and determined that there is misconduct involved, it goes to a discipline hearing, which is quite formal, and lots of training is given to participate on all these committees, so no one's just thrown in there. Fitness to practice basically looks after any concerns about an occupational therapist's capacity to practice occupational therapy. Patient relations was set up originally to prevent the sexual abuse of patients by practitioners, and that is any practitioner in the province. So all colleges have to have all of these committees, and so our college does as well. Fortunately, we don't have a lot of that going on, but we do concern ourselves with professional boundaries, with prevention of sexual abuse, and now are engaging in some of the discussions related to how are we going to outreach to patients in order to have them involved with decisions that we make here at the college. And quality assurance, that particular committee designs the quality assurance program and makes any changes as needed. So those are our committees. All council members sit on at least one of those committees, and more experienced council members would be the chair of one of these committees. So what we do is every year we look at who is still on council, what the makeup needs to be of each of these committees, and people will get an opportunity to participate on more than one of these committees throughout their 3-year term. And if you're elected for a second 3-year term, you have even more opportunity to participate on different committees. So I apologize for the map of Ontario. Yes, it doesn't exactly look like Ontario, but we've kind of morphed it so it fits on the page. But these are the districts that are being elected at this point. And actually, District 3 is where Jane's from, so the London, Windsor type of area. Up in the north and then the far north are the 3 districts this year, and I'll get into the specifics just so you know. So this is District 3, one elected member here, and those are the general areas that you need to be working in or living in order to stand for election. If you have any questions about whether you're eligible, please contact me and I'll work through that with you. You, of course, have to be an occupational therapist and registered with the college in order to run for election. This is the next district, and this is the Sudbury, Parry Sound, all of those areas. So that's how that separates out. And then finally the far north, which includes Thunder Bay, and then as far as Kenora. So 1 member from each of those. So we are electing 3 members this year. So now, in these districts, we've not done electronic elections yet. We've done them in the other districts for the past 2 years. So you guys, this is your first year going through this electronically. So everything is done electronically, including the nominations. So it's actually quite easy. You just it's pretty intuitive. You just follow through. So what will happen is we will send you an email inviting you to submit a nomination, and you would invite people that would support you, and you will send them an email and ask them to support you, and then they will go in and fill out the information, and that's how that works. And so you need 3 people to support you before you can run. It's a much shortened process. Those of you who have been around for a while, remember we used to send out the call for nominations in October. Well, now we only really need to do this beginning of January. The nominations are out for about a month, and then we have a 2-week voting window, and the computer adds it all up, and so it's a very fast process, but it's not drawn out like it used to be in the past. So I think the feedback's been very, very good. Everyone's really happy to do it this way. It is a little bit of learning if you've not done it before, but it's pretty easy. Just make sure we have your correct email in the registrant's login section of the college. So here's the due dates. On January 3rd, we will send out the call for nominations. February 5th, they will close. Then there's the voting for about 2 weeks. And we'll be able to announce the winners just shortly after that. And the first meeting will be the last Thursday in March. And then officially everybody's duties will begin April 1st. So I don't know if Jane or Shannon has anything to add, just let me know, but if not, we'll take questions. So if you have any questions, you can type them in. I do have, Shannon, you want to say something?
I really would encourage, anybody to seek a nomination. My experience with the college has been fantastic. And that's why I have, attempted to do this 3 times. And with each session, I've learned more, and hopefully I've contributed. And again, there's such a variety of people and backgrounds, and I think that's what makes this experience so valuable, is that you are meeting both professional and public members that come from a wide variety of backgrounds, even in terms of where they live across the province. I know that Jane had a little bit more experience when it came to boards and associations and that type of thing, whereas I didn't. But again, the training that the college provides really makes you feel comfortable and gets you up to speed very quickly. Jane, do you have anything else to add?
No, I think you've hit the highlights, Shannon. I think maybe the only thing would be to talk about the support that the staff at the college does provide. I think, again, I think it can be perhaps a little intimidating as a new council member reading all of the material that does come, but certainly the staff is there and very supportive, and the training that's available is outstanding to get people up to speed so that you can feel that you're contributing to the work of the college.
Watch for any other questions. And of course, here at the college, if you have any questions while you're doing this or while you're trying to make a decision or before you're doing this, you can certainly call me. If you have logistical questions, then you can call my assistant, Angelina, as well. And we are certainly happy to help you through this whole process. Here's another question. If elected and we retire from active practice but maintain registration in the college, can we still be on the council? And the answer to that is yes. The criteria is that you have to be an occupational therapist, and you would run out of currency after you hadn't practiced for 600 hours in the past 3 years. So as long as you're got about 600 hours right now, you'd be fine to run in this election. But if you retire immediately, then you probably would only be able to stand for 1 term. But you do have to stay registered with the college. Just give it another few minutes for questions. I had some questions from last time, which I can read you. So one of the questions was what are the qualifications required to run for council? If you go into your bylaws, you can also see that there's disqualification in there as well as qualifications. So you don't require any experience to be on council, because we do train you in terms of how it all works and what you're supposed to do and what the requirements are. So you don't need to worry about that. If you're concerned, if you've had any sort of discipline history with the college, that probably would be one of the reasons why you would not be eligible. So if you're worried about any of that stuff, you can look in our bylaws or you can call me. But you don't need experience. the training is great. We walk you through everything. We don't leave anybody to fail, that's for sure.
And can I just add there, Eleanor, that I think it is important to stress that there is no need to have the experience. I mean, Shannon did talk about her limited experience on a board, but it certainly is not required to have experience, and it's always helpful to have that diversity of experience within the council, because again, that's how the decisions are well thought out, and that diversity does help in bringing all perspectives forward for any decisions that the council is having to make. So no experience is required.
And just another logistical point, that if you do become nominated, then the online form will prompt you for all the information that you need, and that includes like a short paragraph. It includes all your details. It'll ask you for all those things. So it's pretty easy. You do it all online, and then you press the submit button, and then done. So no need to worry about that you're not doing it right, but you might want to think about it right away, because you only have a 4-week window as opposed to the 3 months before that you had. And one more question. Given the distance of the 3 districts up for election, are there any opportunities for distance attendance, or is on-site attendance mandatory? I'm sure there was an appreciation of the time it takes for some further districts to travel Toronto. And I would say that depending on what the topic is about, we generally like to have people on site. We do know that, for example, from Thunder Bay, the flights do come directly into Porter, as well as from Sudbury as well. And maybe I'll let Jane and Shannon talk a little bit about their experiences related to that. But I'm sure you can also appreciate, when we're making some pretty weighty decisions about the fate of occupational therapists who come before our panel, having a very important discussion in person definitely improves the ability of the panel members to deliberate fairly upon that. But having said that, there are some opportunities to make smaller, shorter decisions via teleconference. And Shannon's going to speak.
Yes, being from Sudbury, it's a little bit of a distance. But again, as Jane spoke about her employer being, very helpful and supportive, I would say that my employer has been. Certainly, again, in the 9 years, there's been some changes in terms of travel, at least from Sudbury, with Porter opening up. So now it's got the availability of flying into Pearson or downtown here, where the college is located. So it's actually about a 30-minute walk, so very accessible. And the flights usually are such that it is possible. Again, taking weather into consideration, that can leave actually in the morning, attend a meeting, and then leave after the meeting. I've done that. As well, as Eleanor spoke, there is support if you are coming a distance and you're coming the night before because you want to secure that transportation, and if weather is an issue, you come the night before, and then you can attend the meeting. And again, also keeping that into consideration when you're looking at what committee might be most appropriate for you. But I have had instances where, as Eleanor said, that maybe the decision wasn't as weighty, or I had some flexibility and I was able to teleconference in. But certainly the face-to-face meetings, I do think that there is a different level of discussion that can occur, and that if you're on teleconference, it can make those discussions somewhat more difficult.
So just to know, the college does pay for the accommodation the night before, as well as any flights that are required. And it generally works pretty well for people. And depending on who's involved with the committee and where they're coming from, we can adjust the timing of the meeting. So we might start at 10:30 in the morning to allow people to come in the morning, and make sure we're done by 3 so people can catch whatever train or plane they need to get home. So we try as best as we can to make this as painless as possible.
Eleanor, the other thing perhaps to mention is for those who are traveling a distance where there is a need to come in the day before or the night before, there is also compensation or coverage of the time that is spent doing that. So there is a reimbursement for your time, and that's all managed through policy.
watching for any last questions before we sign. All right, so you know where we are here at the college. You can contact us at the numbers on the screen, or of course we're on the website. You can find us there if you have any further questions. And I thank you very much for your attention today. And please consider standing for a council position or nominating a colleague who you think would be able to do a good job in terms of representing occupational therapists in the interest of public protection. Thank you very much.